Welcome to IVF Success Secrets, brought to you by ProCare Hospital Abuja. I'm your host, Ramona Salim, and with me today is Dr. Fache Moses. Dr. Fache Moses is a renowned obstetrician gynecologist and the MD of ProCare Hospital Abuja. He is a quintessential fertility specialist, and with a stellar reputation, he has garnered great ratings from his patients. Dr. Fache, you're welcome.
Yeah, thank you, Ramona. It's a pleasure to be here.
Today we're demystifying IVF, what it is and why it sometimes fails. We'll just go right in. First off, what is infertility?
All right, thank you once again. Infertility is the inability of a couple to achieve pregnancy within the first year of marriage. That's the traditional definition. Over time, we've come to add that because of the influence of age on fertility, that if a couple is more than, the lady, for instance, is more than 35 years, then they don't need to try for 1 year before seeking help. After 6 months of trying to conceive, then they should seek help. And for those who are 40 years and above, after 3 months of trying to conceive and there is no success, they should seek help. Infertility generally is seen to affect about 15% of women of reproductive age, and so it's of public health significance.
Okay, thank you. What are the requirements for natural conception?
All right, that's a critical question. So if you permit me, I'm going to use this model to answer this question. This is the model of the female reproductive system, where you have the female private part, and this is the womb. This is the neck of the womb here, and then it leads into the womb cavity, which is here. So these are the ovaries, and so these are the tubes. So this is the tube on the left, and this is the one on the right. So not naturally, for conception to occur, there must be semen after coitus. So there will be semen deposited here, which contains live sperm. And this should swim into the womb, through the cervix, into the womb, and then into the tubes. First off, the ovaries, responding to hormonal stimulation from the brain, would usually release 1 egg per cycle. And so this egg is expected to enter into the tube through the widest point here, and then it travels this way towards the womb. In that case, if it meets with the sperm in the tube, then there will be fertilization. Once the egg is fertilized, it forms an embryo, and then it continues to travel and settle down in the womb, in the lining of the womb, which is called the endometrium, and that process is described as implantation. And in actual fact, that is the beginning of pregnancy, because that is when pregnancy hormones begin to be secreted. When implantation have occurred, the pregnancy hormone, which is called human chorionic gonadotropin, begin to be secreted, and then that is what is measured when a woman says, "I have missed my period." We check that in the blood or urine to confirm whether the woman is pregnant or not. So if any of these steps have issues, either because the semen that is deposited does not have enough sperm, or because maybe the cervical canal is not open, or the womb lining is distorted, or the tube is blocked, or the ovary is not producing enough eggs, then there will be no conception. And so that is where fertility treatments would come in after evaluation to determine where and at what point we have issues. I hope that
Yes,
answered. Okay?
quite elaborate. What would you say, what exactly is IVF?
All right. So IVF stands for in vitro fertilization, which is a fertilization outside of the body. In vitro means outside. And then this is achieved in a controlled laboratory environment where the egg of the woman is extracted from her body and then is mixed with sperm from the semen of her husband or partner. So that's what IVF stands for. And basically, that controlled lab environment is such that it mimics the female internal body system. So that's IVF.
Who would you say needs IVF? And when would be the right time for couples to consider that?
All right. So we said, IVF is fertilization outside of the body. And so there are, just like I have mentioned earlier, there are conditions that would warrant that fertilization cannot happen in the body. One of the commonest is when the two tubes that is supposed to ensure that the sperm and the egg meets are blocked. So if the tubes are blocked, then it becomes impossible for the egg that is coming from the ovary and the sperm that is swimming from here to meet, and so there will be no fertilization. This was actually the indication for IVF in the very much, earlier on when it started, where people have bilateral tuber blockage. Before the advent of IVF, such women were considered infertile or sterile. So IVF now is able to take eggs from the ovaries, mix them with the sperm outside the body, create the embryo, and then transfer the embryos into the womb. So that being said, people who would need IVF are women who have bilateral tuber blockage, women who have whose husbands have issues with their sperm and therefore it is inadequate to initiate a spontaneous conception, women who may have issues with their womb, and then, of course, women who have other immune conditions that may not allow implantation to happen inside the body. So these are the broad category of people who need IVF. Over time, there are, other indications for IVF, and currently there are times when IVF is used for to achieve pregnancy in patients who do not have fertility issues, because the indication for IVF now has expanded to cover the prevention of transmission of a certain kind of genetic conditions to the offspring, like sickle cell anemia, for instance. That's one of the common indications for IVF other than fertility. Yes.
Well, thank you for that detailed explanation. In your opinion, why would you say IVF has succeeded? Why do we have success rates for some and then for others we have failures? What could be the reason for that?
Okay, so yes, the simplistic description we gave for IVF makes it look like, oh, it's easy. Just take egg, mix it with sperm, create the embryo, transfer it into the womb, and pregnancy commences. But it's a very complex procedure. When you try, to simulate what happens in the human body in a laboratory, then you would understand that it's not that easy to achieve. And so the process of creating more eggs from the ovaries, process of bringing them together in the laboratory to create the embryo, the environment, which is, the female body now that harbors the uterus, is also very important. The reason why the woman is unable to conceive or the couple are unable to conceive in the first instance can also affect the outcome of IVF. Without proper evaluation, certain things may be missed, and so this explains why IVF is not 100% treatment. So it can succeed in one person and not succeed in others. And then it can succeed for one patient, and after another cycle in the same patient, it may not be successful. So most patients would have at one point treatment that were not successful, at another point it becomes successful, and some who previously have a successful treatment and subsequently is not successful. So there are a lot of things that need to be put together to be able to have a successful IVF.
So we've heard a lot about success rates. What do the percentages mean?
That's a very critical question. Success rates, when you talk about rates, most times it's something that is retrospective, which means, for instance, if we're looking at IVF on the surface, we would say, okay, last year, for instance, how many people did a particular clinic treated for IVF? So if you treat 100 patients, how many of them conceived? And so you can look back and say, oh, last year we treated 100 patients, 65 of them or 70, of them, which is 70%, succeeded. And so on that basis, you could say your success rate is 70 out of 100, which is 70%. Now, was this the same thing that you had the year before last? It's not likely. So when you find that hospitals dish out, rates without context, then it doesn't quite hold water, because most of the time these rates are arbitrary. 100 people were treated does not mean that they all had just one cycle. Some of them may have had 2 cycles. Some of them may have had 3 cycles before they were able to conceive. So you could have 100 patients treated, but maybe in total they have about 220 cycles that were done before that 70% of them conceived. So if you have a clinic that wants to be transparent and the clinic says, we're calculating our rates based on the total number of cycles, not just the patient, because if the patients didn't stay to do second or third cycle, you would not have had that 70%. Okay, so this is one perspective. So, okay, is this rate on the basis of just how many patients got pregnant, irrespective of the number of cycles that they've had? Or is it based on the denominator now? Is it based on the number of cycles that were run? Now, is this rates that we are given, is it consistent across all ages? Are you saying that this 65% or 70% that you're quoting, does it apply the same way it applies to 25-year-old woman, to a woman that is 42? Not likely. So, it's a whole, elaborate topic, which in one of our series, I hope we will be discussing, intensively about success rates. Because the other aspect to look at it is, what exactly is success? What is success to the patient may not be success to the clinic. How would the patient feel if you know that, if she knows that she has been counted as success in a hospital, whereas that pregnancy she miscarried at 10 weeks? The hospital has counted her as success because she tested positive to pregnancy test. And then, but the main reason why she went to the clinic was to have a baby and not just to be counted as a number. So what is success? So in that context, so we are looking at scenarios where people would ask, probably, what is my chance of having a baby? Rather than just believe in advertised percentages by hospital. Look beyond that. Look at transparency. Now, because this is, a whole issue in the IVF industry where patients are probably knowingly or unknowingly by fertility clinic deceived into treatment because hospitals, clinics are brandishing high numbers, and the patients are excited to hear, oh, you have 85% success rate, you have 95% success rate, but there is no context. If you are 42-year-old, 43-year-old, where you have reduced number of eggs, poor quality of eggs, your success rate per cycle cannot be 85%. So if you go to a hospital that says our success rate is 85% and you are happy, and you quickly say, okay, yes, this is where we're looking for, you'll be disappointed at the end of the day. And so just relying on those quoted figures would make women have unrealistic expectation, which is a recipe for very difficult disappointment at the end of the day if their treatment is not successful.
So, next thing that comes to mind is, can two women of the same age have very different IVF results, and why would that be?
Okay. Thank you very much, Ramona. Age is one of the main factors that we use. In fact, when we talk about IVF successes or even chances to conceive naturally, age is very important. I used to say that age and fertility are not friends because the older a woman gets, the less her chances even of conceiving naturally. If you imagine, for instance, that a 25-year-old woman or lady would have maybe a 25% chance per month of conceiving because she has good quality eggs, good number of eggs. By the time that same woman gets to 40, that monthly chance will have dropped to about 5 to 10%. Why? Because her egg quality have reduced significantly and the quantity. So this is more pronounced in IVF, where unlike in natural conception, where one egg can start and complete the journey, in IVF, success is directly proportional to the number of eggs that you are starting with in the beginning. So if you have a patient or a client who has poor egg yield, then you might not, have the same result. So coming back to your question, women of the same age having different outcome, yes, because they might have different underlying reasons why they were infertile in the first instance. The woman could possibly, maybe one of them had polycystic ovary syndrome. The other person, the husband, has very bad semen. One of them could have fibroid. The other one could have endometriosis. These are conditions that affect a woman's chance of reproduction, and it also affects IVF success. So preparation, again, is key. Evaluation to determine diagnosis is very important so that you can now streamline. IVF is not one size fits all. So you can streamline what protocol to use for each person so you can optimize their chance of conception.
Thank you very much. Are there misconceptions you would like to clear? What are the common misconceptions on IVF that you would like to clear?
Okay. There are a lot of misconceptions that come along in IVF. One common one is most patients feel that IVF is a magical kind of treatment where they present and say, I have tried every other thing, it didn't work, and I've been told to come and do IVF. So they come with that expectation, like we're here, this almighty treatment, most especially that is an expensive treatment. Anywhere IVF is expensive compared to other fertility treatment. And so when they show up, they come with that expectation that this is the final bus stop. So, but it is important for them to know that IVF is not, there is no guarantee. It can fail. And so it's not always positive. So the second myth is the fact that a lot of people, because of lack of proper understanding of the IVF process, believe that babies from IVF may be different from babies that are conceived naturally. But again, that is not correct. Since 1978, that the first IVF baby was born, millions of babies have been born through IVF, and there is no evidence to suggest that IVF babies are different in any way from babies that are conceived naturally. The third misconception is the fact that people always feel that IVF will lead to twins or multiple other pregnancy. This is a misconception. In fact, the tendency is for us to try as much as possible to simulate nature and then transfer one embryo back most of the time. But again, because there are aspects of IVF that even as a specialist and expert, we still fully do not understand. Sometimes we tend to put, maybe 2 embryos back just to increase the chance of success and not necessarily so that we'll have multiple pregnancy.
Thank you, Dr. Fachi. That was an eye opener. To our viewers, whether you are just starting or you've had previous attempts, this series is for you. We've learned that IVF is not a one size fits all. We've also learned that babies born as a result of IVF are no different from other babies. We've also learned that IVF is not only the answer to multiples. If you enjoyed this, please join us on our social media networks and then make sure to refer a friend to our platform and make sure to leave a comment. Join us same time for our next episode, which is on Are You Really Ready? The pre-IVF prep most people skip. Thank you for watching.